Academy of Diet and Fitness.
Chapter 12: Nutritional Epidemiology in Nutritional Biochemistry.
Dietary patterns in nutritional epidemiology. In nutritional epidemiology, dietary patterns are crucial, emphasizing overall dietary habits over individual nutrients or foods. These patterns reflect the mix and frequency of foods and drinks in someone's diet. By studying them, researchers can assess how diet as a whole affects health and understand its impact on disease risk and well-being. Here are key aspects of dietary patterns in nutritional epidemiology. Definition: a dietary pattern is a combination of foods and beverages that are regularly consumed over a defined period, such as a day, a week, or a year. It reflects an individual's overall dietary habits. Data collection: researchers assess dietary patterns using various dietary assessment methods, such as food frequency questionnaires, FFQs, 24-hour dietary recalls, or food records. These methods capture the types, amounts, and frequencies of foods consumed. Statistical techniques: PCA and FA are statistical methods frequently used in nutritional epidemiology to determine dietary patterns from dietary data. They group foods commonly eaten together and identify key dietary patterns within the study group. Types of dietary patterns: dietary patterns can be categorized into different types, like the Western pattern, high in processed foods, red meat, and sweets; the Mediterranean pattern, abundant in fruits, vegetables, whole grains, and olive oil; and the Prudent pattern, rich in fruits, vegetables, nuts, and fish. Health outcomes: researchers examine the association between dietary patterns and various health outcomes, including chronic diseases, e.g., cardiovascular disease, diabetes, certain cancers, obesity, cognitive function, bone health, and overall mortality. Synergy and interactions: dietary patterns consider the interactions and synergistic effects of various nutrients and bioactive compounds present in different foods, which may lead to different health effects compared to individual nutrients. Cultural and regional variations: dietary patterns can vary based on cultural practices, regional cuisines, and dietary traditions. These variations influence the health effects of different dietary patterns in different populations. Longitudinal studies: prospective cohort studies follow individuals over time to investigate the relationship between baseline dietary patterns and subsequent health outcomes. These studies provide valuable insights into the long-term effects of dietary habits. Recommendations and guidelines: dietary patterns research informs the development of dietary guidelines and recommendations for the general population to promote optimal health and reduce the risk of chronic diseases. Personalized nutrition: nutritional epidemiology also explores the concept of personalized nutrition, tailoring dietary advice based on an individual's dietary patterns, health status, and genetic factors. Analyzing dietary patterns offers a holistic view of how diet influences health outcomes, considering how different foods and nutrients work together. This method allows researchers and policymakers to make informed suggestions for encouraging healthy eating habits and preventing diet-related diseases on a population scale. Public health implications in nutritional epidemiology. In nutritional epidemiology, public health implications involve applying research findings on diet, nutrition, and health outcomes to the broader population. Understanding dietary patterns, health effects, and the role of specific nutrients and foods in disease risk informs public health strategies and interventions. Here are key aspects of public health implications in nutritional epidemiology. Dietary guidelines: nutritional epidemiology is pivotal in crafting national and international dietary guidelines and recommendations. These guidelines offer evidence-based guidance on fostering healthy eating habits, lowering chronic disease risks, and meeting nutrient needs. Health promotion campaigns: public health agencies rely on evidence from nutritional epidemiology to create health promotion campaigns encouraging healthier dietary habits. These initiatives might emphasize consuming more fruits and vegetables, cutting back on processed foods, or adopting balanced eating patterns. Disease prevention and management: nutritional epidemiology identifies dietary factors linked to disease risk and management. Public health interventions may target certain populations to lower the occurrence of chronic diseases like cardiovascular disease, diabetes, and obesity through dietary changes. Community nutrition programs: nutritional epidemiology aids in creating community-based nutrition programs catering to vulnerable populations like children, pregnant women, older adults, and those with specific health conditions. Food policy and regulations: nutritional epidemiology shapes food policy, influencing labeling, marketing restrictions, and taxes to promote healthier choices. Health disparities and equity. Nutritional epidemiology reveals disparities in dietary habits and health outcomes among various socioeconomic groups and ethnicities. Public health initiatives can then address these gaps, ensuring fair access to healthy foods and nutrition education. School nutrition programs. Nutritional epidemiology supports evidence-based recommendations for school nutrition programs, ensuring that children have access to nutritious meals and snacks that support their growth, development, and academic performance. Healthcare provider guidance. Healthcare providers use findings from nutritional epidemiology to provide evidence-based dietary counseling and personalized nutrition recommendations to patients, especially those at higher risk for certain health conditions. Research priorities. Nutritional epidemiology guides research priorities in nutrition and public health by identifying knowledge gaps in areas that require further investigation to improve understanding and address emerging health challenges. Economic impact. Public health implications in nutritional epidemiology also extend to the economic realm, as diet-related chronic diseases can place a significant burden on healthcare systems. Public health interventions focused on improving dietary habits can lead to cost savings and improved health outcomes. Nutritional epidemiology profoundly influences public health, guiding policies and initiatives to encourage healthier diets, alleviate chronic diseases, and improve global well-being. Limitations and challenges in nutritional epidemiology. Nutritional epidemiology, though valuable for studying diet and health, has limitations and challenges. It's essential to consider these factors when interpreting research findings and advancing the field. Here are key limitations and challenges in nutritional epidemiology. Measurement errors in dietary assessment. Dietary assessment methods, like food frequency questionnaires and 24-hour recalls, depend on self-reported data, which can be biased and may underestimate or overestimate food intake. This can lead to exposure misclassification, impacting the accuracy of associations between diet and health outcomes. Confounding factors. Even with efforts to control for confounding variables, residual confounding can persist, particularly in observational studies. It's hard to fully address all potential confounders, and unmeasured factors may affect observed associations. Causality and reverse causation. Observational studies can't definitively establish causality, and there may be a bidirectional relationship between diet and health outcomes. For instance, people with health conditions might change their diets due to illness, causing reverse causation. Generalizability. Findings from nutritional epidemiology studies may not be directly applicable to all populations due to variations in dietary habits, genetics, cultural practices, and lifestyle factors. Misreporting and social desirability bias. Participants may misreport their dietary intake due to social desirability bias or misperception of portion sizes, leading to inaccuracies in dietary data. Lack of biomarker validation. Some dietary assessment methods rely on biomarkers to validate nutrient intake. However, not all biomarkers are well validated, and some may not accurately reflect short-term dietary changes. Long-term dietary changes. Nutritional epidemiology often relies on short to medium-term dietary data, but the health effects of long-term dietary changes may not be fully captured in such studies. Limited food databases. Some dietary assessment methods rely on food composition databases, which may not accurately represent the nutrient content of all foods consumed, especially in diverse populations. Ethics and feasibility. Conducting randomized controlled trials for long-term dietary interventions can be challenging due to ethical considerations and participant compliance. Multifactorial nature of diet. Diet is complex and multifactorial, making it challenging to isolate the effects of individual nutrients or foods from overall dietary patterns. Publication bias. Studies with significant or positive findings are more likely to be published, leading to potential publication bias and an overestimation of the magnitude of observed associations. Changing dietary landscape. Dietary habits and food availability are constantly evolving, making it difficult to keep up with current trends and adapt study designs accordingly. To tackle these challenges, researchers need to collaborate, continuously improve methods, standardize dietary assessments, and interpret findings carefully. Using various study designs and rigorous statistical analyses can bolster the evidence base in nutritional epidemiology, aiding in more precise public health recommendations.